But just the fact that she wrote this message, like me and my husband, we talked about it. We have two eyes. And if there's anybody in Iran that has lost both their eyes, we're willing to donate one of our eyes. And that just melted my heart. The fact that we're just the people that live in Iran, they just care so much about each other. Um, that's something you don't really see in the Western world or in social media.
Dr. Kayvan Mirhadi, Dr. K, joins me from upstate New York today. Hello, sir.
Hi, Jian, how are you?
I'm all right. Thank you. How are you holding up?
Good. One day at a time. You know, it's tough, but we're I'm losing track of time now, but it's going.
I can imagine it's a 24/7 pursuit for many of us, but certainly in terms of what you're doing. I wanted to just set the stage for what goes on in Iran, and one of the most troubling parts of this uprising in Iran is realizing the fact that victims of the regime's crackdown and brutality are fearful of going to the hospital because they may be arrested if they go there. I suppose it's a bit absurd to try to assess the ethics of what this regime does, but there must be international standards about medical care without danger, is there not?
Yeah, I mean, if you look at the Geneva Convention or World Health Organization, they speak of patient privacy, they speak of the right of every human being to access healthcare at any time. And during the last several weeks, that's not really the case in Iran. There, people are scared to go to the hospital. The doctors are scared to take care of the patients that are injured during the protests. It's I've been calling it the medical crisis in Iran.
Yeah. And I imagine you're not just hearing from the patients or the victims who need your help, but from the doctors as well, who are caught somehow in the middle.
Yeah, it's a tough job when you can't do your job. You know, these doctors swore an oath, the Hippocratic oath, to take care of any human being at any time with their beliefs, sexual orientation, um, um, the political relations, and they cannot perform their duties. So they are conflicted as well. Um, it hasn't been publicized to a fact that, you know, you cannot treat patients that are like injured protesters, but it's understood as a whole. So, you know, most healthcare providers in Iran have been doing it, but undercover, a lot of them have been arrested and imprisoned and even beaten up. There's been so many cases of, uh, you know, CEOs and medical directors being in ICUs because they were merely protecting patient privacy. And this, you know, once the news gets out there, a lot of doctors are fearful of doing so. So it's just a horrific situation right now.
And I think if I remember correctly in my history that even during wartime, even in the most vicious of wars, medical units are generally considered neutral territory that you're not supposed to mess with, right? That you're not supposed to violate.
Exactly. I mean, anybody injured, you have you have the right to get medical care, and that's understood even during wartime. And this is an internal conflict that's been going on for several weeks, and obviously people get hurt, but they're just so fearful of going to the hospital. They come to their house, and if they know a trusted doctor, they'll contact them. But again, in those, if we lived in Iran right now, it would be hard to trust anybody. So
Yeah.
they've been reaching out to me and my friends and other doctors and nurses on social media and asking questions about their injuries.
Okay, so I'm speaking of doctors needing to do their job. You have a day gig, which is a significant one, chief of internal medicine. I would imagine that keeps you quite busy. You've had thousands of people inside Iran reach out to you for medical care and advice. How have you been managing all of this?
So I'm not alone. Obviously, there are so many doctors doing it. My page just has the most followers, and it's seen more. But there are a lot of doctors and nurses and healthcare professionals doing this, and I want to give them props for everybody for doing this. But it's been very busy because we also have two kids. My wife, honestly, she's been helping out a lot. She's also involved in the page, and she triages a lot of these messages and sends me, the ones that are critical. And we did put out information about including SOS at the bottom of your message so it gets seen first. Because I still get messages about coronavirus and other illnesses,
Mm.
but right now I've been really responding to the issues that the injured protesters have. But it's just been very, very, very busy for us.
Right. I love that you use the medical terms rather than say she edits, who, she triages. Um, I
Yeah. No,
guess you're stuck in the hospital. That's the language you're going to use. Um,
yeah.
uh, can I ask you from your perspective? It seems like, I mean, devastatingly so, horrifically so. It seems like things are getting more brutal in terms of the crackdown. We're hearing more about more deaths. We have situations like Zahedan and Kurdistan more recently, where it seems like there's just wanton mass killings. We hear about more injuries than we were hearing about, and deaths than we were hearing about in the first 2 or 3 or 4 weeks. Do you have any sense of, in terms of the response you're getting, the demand that is coming into your inbox, of whether this situation is getting a lot worse?
I think what's changed is the reachability of the type of people that are getting injured. Like those areas do not have great access to internet and Instagram and social media. So I'm not able to help them as much. It's just getting very difficult to reach these individuals. And it's very unfortunate because the healthcare there is very protected to the point that they cannot even bring medication or medical care to that area because the roads have been blocked from any type of transportation. So I do keep communication with people that live around that area, but they're telling me there's shortage of medical equipment, there's shortages of antibiotics, any type of medication, and they want to send it to them so they can take care of themselves, but they cannot because all the roads are blocked. So people are finding very creative alternative methods of delivery of medical care, which boggles the mind that this is actually happening in this day and age. But that's really what I've been, or a lot of us doctors and healthcare professionals have been involved in the last few weeks because the crackdowns are getting more severe in isolated areas where we cannot really reach them.
Yeah. You were doing this kind of work in terms of providing online advice and help and care during COVID. Um, was it an obvious or um, natural segue once this uprising began to be doing the kind of work you're doing now?
That was more kind of education because everybody could still, if they had some severe COVID and they needed to be evaluated by a physician, they could simply just walk down the street to the nearest emergency room, or they all had doctors where they could go see. So my position was mainly awareness of vaccination and decreasing fear of what a pandemic is and how deadly this virus is. A lot of the Iran, unfortunately, had, I think it was the epicenter of, false information, and it would just radiate through the social media. So I was very involved in debunking myths. But right now, it's a whole different game that I'm involved in, and it's very difficult because at times it feels like my hands are tied. There's so much I can help somebody in terms of their injury. For example, like if you have a first degree or second degree burn, or if you have pellets in your body because you were running away from the authorities, I can kind of guide you towards the first aid and the main things you can do. But if it goes beyond that, like if you get very, very sick, you go into septic shock, you go into renal failure, these are things I cannot provide. So we've been working with doctors in Iran that have been going into these individuals' houses and helping them, or hospitals that are accommodating them. There are a lot of doctors that are falsifying diagnosis, which again, this is unheard of because you could lose your license. It's malpractice to falsify diagnosis, but their hands are tied. They're putting, removing a tumor from somebody's knee where they're removing a bullet.
Mm.
So everybody's trying to find ways to save lives, to help humanity, but they are making it more difficult.
Let me ask you about some medical specifics, or some specifics of what you have to deal with in terms of what you've just said as well. You mentioned pellets. We hear a lot about the use of pellet guns. Can you describe a little bit about what that is and what the implications of wounds coming from pellet shots are?
Yeah, I mean, it's just like the BB gun, but there's different tiers of them and there's different sizes of pellets. And the ones that are being used most often are bird shots. And these include, with every shot, there are multiple small, tiny pellets that essentially propel into the air. And individuals end up suffering from multiple entry points, anywhere from 10 to 50 to 100 to 300. And the more wounds you have in your body, the more the inside of your body is exposed to the outside world. And that's when you can get infected, your blood pressure can drop, and you could essentially die. And the pellets themselves, they're not like an actual gun, like a bullet from a gun where they can, break bones or shear arteries. But again, like depending on the distance where you get shot from, they could. I mean, if it's very close shot, it could still penetrate like an artery, and there could be internal hematoma and bleeding. So they could be very dangerous. I've heard so many cases where people got shot in their chest and it causes something called a pneumothorax, where your lung essentially
Mm.
collapses. And if you're not treating this right away, it could press on your heart and cause a hemodynamic instability. I don't want to use as much medical terms, but essentially you can go into cardiac arrest. So these things, I, I talk to people that have happened this to them
There,
because of
there,
this shot.
there there also seems to be quite a lot of incidents of people losing eyes or getting shot in the eyes. Is that the same pellets we're talking about?
Yeah, I mean, if you get multiple pellets in your eye, essentially and it injures your retina and or your optic nerve, which is like the large nerve that carries all your, the images that you see, then that eye you cannot save. And then there is a risk of infection happening in the ocular orbit, so they have to uh, remove the eye completely. So these individuals end up getting a glass eye for, aesthetic reasons.
Dr. K, what have you heard? What do you know about? I saw one of your posts about it, so I know you've thought about it somewhat. What do you know about this? The news about gases, some kind of poisonous gases, or some kind of chemical agent that has been used?
It's not clear because, it's a lot of it is coming from images that people took on their phone. Really, for us to know what gas it was, you need somebody like a chemical engineer to analyze the gas and let us know what's inside of it. But there was a lot of, I think it was last week, there was a tweet going around from one of the protests in the street that there was a green gas, and a lot of them compared it to chemical warfare. Um, I mean, it's possible that they're using it. A lot of the symptoms that people report to me are not typical tear gas symptoms. When they have issues with their breathing, when they have these rashes that appear on their skin, because tear gases were being used even, in other countries. We just did not see similar symptoms. So there's suspicion that there could be other chemicals used in these confrontations.
We've been talking about physical injuries. There's a fair bit of psychological harm happening to people. Do people contact you about trauma of that kind as well?
Yeah, I mean, the most unfortunate are I've had several cases of women in these protests that they've been attacked and arrested and essentially sexually assaulted or raped. Obviously, these women are all going through psychological trauma. Anybody involved in this movement right now will have PTSD, anxiety, depression, difficulty sleeping. Individuals that are arrested and they get released, I'm sure you've seen it. Many of them commit suicide after because they unclear what goes on when they're arrested because we don't really know. But
Kids, in some cases, teenagers, they've been
it's
committing
yeah,
suicide.
I've even had people message me like, "Oh, my brother just got released from jail and he's just sleeping for several days or weeks. And I don't know, maybe he was injected with something while he was arrested. It's just, it's very hard for me to tell what they're doing to these individuals that are arrested, but it's having serious consequences.
I mean, there are lots of people facing horrific injuries inside Iran, but there is something that Iranians are experiencing everywhere in the world. Everyone we talk to on this program in the diaspora, and that is, I call it doom scrolling through all the horrible news, and there's a lot of insomnia going on. A lot of people, including myself, are having trouble sleeping. You recently posted a video about how to deal with lack of sleep. Can you describe some of what you said?
Yeah, essentially, from everyday trauma that we're going through, we're all going to have issues with sleeping. So some of the basic things that I posted were, distance yourself from your phone, even if that's for a day. That's treatment on its own, because just getting exposed to daily news that are coming out, just seeing people's pain and suffering is going to affect your well-being. Lack of sleep is not just going to be manifesting itself in you being tired. There's so many physiological things associated with a proper 6 to 7 hours of sleep every night. So you're going to notice hair loss, issues with your blood pressure, cardiovascular effects. So sleep is fundamental for all of us to be able to carry on. If our mission is to help the people of Iran, help this movement, we need to be healthy ourselves. So a lot of things included in that post were essentially the main point was distance yourself from the news for a day or so to revive, but also some practical things like do not eat before you go to bed, do not go to the gym half an hour before you want to go to sleep. If you can't sleep and let's say you're lying down and you're not falling asleep, don't just lie in your bed. Get up, walk around, do something else, and then come back and try it again. I'm guilty of that. I just lie down for 2 hours waiting for me to fall asleep, and that never happens. And then I talked about a few medications that can help. And, the main one is melatonin, which is the safest one to try.
You talk about people helping folks in Iran, and we've seen, and you've mentioned that it's not just you. There are other doctors and nurses and of Iranian stripes, but also doctors around the world stepping up for Iran. You posted a video from a group called Doctors for Iran 22 last week. Tell me what you've been seeing in terms of doctors across the globe joining this cause.
Everyone is unifying, and their mission is to help all the doctors and nurses and medical professionals around the world. There are a few groups being formed in U.S. and Canada and in Europe, and they essentially have WhatsApp groups. They have Telegram or Instagram, and they want to promote their page in terms of being able to help people in Iran. The one that I was very involved in is a group called MASA that kind of started in US, but it also has physicians from around the world. And they did come up with a phone number where, they are taking shifts on throughout the day, 24/7 to answer that phone. And they, allow anybody to call from Iran. If they're in need, they can call and they'll be connected to a doctor who's going to guide them towards what to do.
I'm so grateful that you've given us this time and that we get to hear your insights. And I know there's so many folks who are following you and appreciating what you do. Let me end off by asking you a couple of personal questions, if I can. First of all, I mean, we just talked about insomnia and the trauma that people are dealing with, and you were prescribing taking a day off, looking at what's going on. That doesn't seem like something you afford for yourself. How are you managing the emotions of dealing with all of this?
It's really hard. Honestly, it's something I've never experienced in my life. I grew up outside of Iran. I moved when I was 12 years of age. I grew up in Toronto, Canada. And I, it was hard for me to connect to what's going to Iran at that age. And then when I got involved with this page over the last 3 years, yeah, it's just accumulating I feel like I feel the pain of Iranian people every day. During Corona, I really felt that because they felt so isolated. They were one of the only countries that they were begging for a vaccine. And because of political issues, they were not, you know, they were going to offer them the Pfizer vaccine, but they refused it for, so it just accumulates for me. And over the last several weeks, it's very hard to deal with my emotions. Like I don't know how. I feel like I'm helping, but at the same time, I feel like I'm so far away that if I was there, I would be of more help. So I'm trying to deal with my current emotions, and it's very hard. So what I do recommend whoever asks me right now is to get a therapist and really talk it over with a therapist and talk about your feelings and what are your plans. And I focus on things that I can accomplish. For example, today, like today for me was to, go to the gym, try to answer questions that people are asking me. And next is to go see my family and do things at work. It's hard to think about what's going to happen tomorrow or next week because everything is uncertain right now. So my advice would be talk to somebody like a professional therapist. Don't talk to another person who's losing their mind with what's going on. And then really focus on what you can accomplish today and then worry about tomorrow.
Well, I certainly hear you on being a Toronto kid who, or at least for most of your life, and who feels extremely connected to Iran right now, and is feeling that connection to the people inside Iran. Tell me what's the hardest part of what you do? I know that doctors are very practiced at not getting too emotional because it would be a job liability in terms of what you have to face. But uh, have you been crying? Are there moments where it becomes overwhelming even for you?
Honestly, like every doctor has cases. So unfortunately, we think very kind of pragmatic. We think like computer at times. We have to, as I use the word triage and those medical lingo, we have to think that way because when there's an emergency, we cannot be emotional and get too involved with the patient and their family. We have to really think medically how we can save this patient's life. And sometimes we can't. Patients will die, and every doctor that you will talk to has, these memories imprinted in their mind of patients they could have saved, and they die. And I have several during residency when you're not, when you're still inexperienced, you're taking care of patients. I still remember the face of those individuals that died in front of me that I felt like I could have saved. Over the last few weeks, there's a lot of images that, although a lot of people don't send me a picture of their face, but I know I see pictures of their arms and their legs and their stories. And these are kind of imprinted in my mind, and it's very hard to forget them. So it's very tough to deal with it. But every day I have to tell myself like what I'm doing is good. I'm trying to help, and I hope everybody feels like that's what they're doing right now because the smallest thing you can do will make a difference. And it's hard to deal with it. And yeah, I've cried so many times. Yeah, um, it's I don't want to say anhedonia where you just have no connection to the outside world, but I felt that,
Mm.
that I see things happening in front of me, and I just have to think like a computer. What's the next step I can do? Um, but I really hope that if we all kind of join and we talk about it, and we can take a step forward, and hopefully help the people of Iran.
How old are your little ones?
I have a 2-year-old and a 5-year-old, and they act like they have so much energy, and it's very hard.
Does the 5-year-old, they starting to understand what's going on, or do you try and shield them from that?
We don't allow them to get too involved in what's going on just because I don't think they would understand.
Yeah.
And sometimes, my phone is full of images of people's injuries, and I don't allow. Like my daughter used to grab my phone to look at pictures. Now she can't. So we're putting limitations on how much they get exposed to these things.
Is there, before I let you go, is there something, if I say, tell me about something that's really inspired you, a story or a person or something that you've dealt with that has been such an inspiration for you, where in the last couple of months, where does your mind go?
I think most recent that I actually posted about this last night. I put I just started scrolling through messages and I saw this woman message me about donating her eye. And we talked earlier about how so many of these young individuals have lost their vision and they're blind, some of them in both eyes. Um, and that just kind of touched my heart when I read it. And from a medical side, and I made a post about it, you cannot donate an eye because I explained in my post that, you have this nerve that's attached to it. And right now we're not at a level to take somebody's eye and connect it to that nerve because that nerve has millions of small little fibers. And we think in 10 years we can do this, but not right now. But just the fact that she wrote this message, like me and my husband, we talked about it. We have two eyes. And if there's anybody in Iran that has lost both their eyes, we're willing to donate one of our eyes. And that just melted my heart. The fact that we're just the people that live in Iran, they just care so much about each other. Um, that's something you don't really see in the Western world or in social media. They don't talk about that. But there's so much kindness and what's the word, like as khod gozashtegi, like I don't know if you know. Sometimes it's hard.
Giving of oneself. Yeah, yeah.
Yeah, just giving up, and trying to help each other. And that was just one example. And I've had so many of them. I talked about shortage of medication. All these people message me like, I have this medication, I have that medical thing I can donate. I talked about, some people cannot afford medical care. Everybody starts donating money. It's just we care so much about each other. And that's the beautiful thing about this movement that we all want to just live happily next to one another and help each other. And really that touched me.
Dr. Kayvan, I really appreciate you and I really appreciate the time today. I know you're busy. Hope to talk to you again soon.
Thank you so much, Jian.
Bye bye, Eza.